or sponsors. Encouraging, educating, and empowering you into action. This is Warriors Talk with your host, Lady ReShell.
Hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It's Health and Wellness Monday, and our topic for today is Understanding Thyroid Function. We are live on Intellectual Radio. We just heard from the Drive at 5 with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. On the last episode of Warriors Talk, I spoke with Sharon Rivera Sanchez, and we talked about a voice for the voiceless. Head on over to YouTube and type in Intellectual Radio and stay connected for any episodes you may have missed. The quote of the day is, "He who has health has hope, and he who has hope has everything." Let me read that again because this is an important quote. He who has health has hope, and he who has hope has everything. Here are your trending topics for today. Backlash occurred soon after a monument meant to honor Reverend Dr. Martin Luther King and his wife, Coretta Scott King, legacy in Boston was unveiled. The 20-foot tall, 40-foot wide, The Embrace statue was unveiled Friday on Boston's Common, where King gave a speech back in April 23rd of 1965 to a crowd of 22,000 people. The statue was inspired by a photograph of King and Scott King, which captured them hugging after he won the Nobel Peace Prize in 1964. The art piece, designed by Brooklyn-based conceptual artist Hank Williams Thomas, only featured the couple's arms during the embrace and no heads, which has sparked criticism and mockery online. Some people described it as a hideous and disrespectful, while others posted memes and said it resembled a sex act. Seneca Scott, a community organizer in Oakland, California, and cousin to Scott King, told CNN the statue was insulting to his family. He previously described it as a masturbatory mental homage in an essay published by Compact Magazine. If you look at it from all angles, and it probably two people hugging each other, four hands, is not missing heads. That is the atrocity that other people clamps onto. It's the stump that looks like a penis, he said. That's the joke. And that's what Scott told CNN. But Martin Luther King III said on Monday that he was grateful to be able to see the statue resembling and representing his parents' love story and partnership, while other people have negative opinions about the monument. He told CNN and Don Lemon on Monday that he liked it. So there you go, guys. Those are your trending topics for today. I want to highlight my sponsor, Emanuel C.O.G.I.C, with Pastor Michael Richardson, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emanuel C.O.G.I.C at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emanuel C.O.G.I.C-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson, and we're from the Emanuel Church of God in Christ. We are building upon a solid foundation.
My special guest today is no stranger to Warriors Talk. She is our healthy solution expert with over 20 years experience as a family physician. And guess what? She's impacting lives every single day. Hey, Doc.
Hey, Lady ReShell. How are you today?
Good. Doc Michelle, everybody is joining us today to drop some wisdom, some gems, as she always do.
Yes, I'm not in my usual space. I was telling you, I was out. I was at my son's basketball game, and the game before his had 2 overtimes. And so I'm not in my usual location. I'm on my way home, but I wouldn't miss it to talk to your guests, to your audience, so we can still chat. I am not driving. All is well.
Well, I thank you for your dedication to consistently get the information out to the listeners. So thank you so much for that.
Absolutely. Absolutely.
And if you are tuned in on any form of social media like the show, share the show, please invite someone else in on the show that may benefit from this valuable information. We're going to talk about understanding thyroid function. And some of us may not know exactly what the thyroid does. We've heard of it, but we just don't know what the function does. But my Leah says, Doc, she loves the episode with Doc Michelle. She's here and she's ready to learn.
Thank you, my Leah. Yeah, so the thyroid, just to start off, right? The thyroid, this little gland right in the front of our necks, we don't even think about it. We don't feel it unless it's swollen. You wouldn't know it was there, right? But the thyroid does a lot of things for us to help regulate our bodies. And so it's important to know that it's there, that it can be either over functioning or under functioning, which can affect your body, right? So the thyroid, we think about it as a gland that helps with metabolism. That's, when you eat, when you have food, it should turn that food and everything into energy for your body. But the thyroid hormones, which are made in the thyroid gland, so just a little bit of science, right? So the thyroid gland gets a signal from your brain to say, okay, let's keep your thyroid hormones in a normal level. And it either releases hormone or it sort of stops how much hormone is released. And there are many symptoms that can come if your thyroid is over or under functioning. So we can start with an underactive thyroid, which is hypothyroidism. A lot of people may have heard of that because the symptoms sometimes will bring folks to the doctor. Weight gain, fatigue, tiredness, not sleeping well or sleeping a lot. And those are some of the things that write off that will bring people to the doctor: irregular menstrual cycles, feeling cold all the time. And if you think about those type of symptoms could be from a multitude of things, right? It's very sort of generic symptoms that can come from anything. But the thing is, if you're having those type of symptoms, the only way to really know what the cause is to see your provider, see your doctor, have an exam, get a history, and do some blood work.
What made me think of the hyper and the hypo made me think of diabetes. When they have it for when their levels are low or when their levels are high, because it's kind of like the same vocabulary.
Right. You're hypoglycemic when your sugar is too low, hyperglycemic when your sugar is too high. And both of those, well, we can talk about what causes hypo and hyperthyroidism too, but the low thyroid kind of gives those sort of sluggish feeling, as we talked about, feeling cold, irregular cycles, not sleeping well, all of that. And then an overactive thyroid, the other end of the spectrum, where your thyroid is just putting out too much thyroid hormone, can give you other symptoms. Like you can feel very jittery. You can feel very anxious. You may feel hot all the time. You may lose weight when you're not trying to lose weight. Even, feeling tremors and weakness in your muscles are signs of hyperthyroidism. On the other spectrum of hyperthyroidism, we talk about goiters, where that thyroid gland gets really swollen and overactive, and people think of the swollen eyes that they can see from having untreated hyperthyroidism. But really important because, again, if you look at the symptoms, right, having trouble sleeping, it could be due to a lot of different things, right? We don't necessarily think of this thyroid as the cause. But again, it's so important that if you're having symptoms that seem out of the norm for you, that you go and get it checked out. We always talk about that, right? Don't sit on your symptoms. Don't think, oh, it'll go away. You know, if it's persistent, definitely have that checked out. And then we can talk.
I just
Go
wanted to
ahead.
read a statistic really quick. It talks about a woman is about 5 to 8 times more likely to be diagnosed with thyroid conditions than a man.
Yeah, that's very true. And thyroid disease is pretty common too, right? I think it's about 20 million
Yes.
people in the US are living with thyroid disease. And so it's common in women, it's common as we get older. Sometimes after pregnancy, people can have hypothyroidism. So there are different causes that can occur. And we think about those that you mentioned, as well as the thyroid itself can just get inflamed, which is called thyroiditis, which can cause you to have hypothyroidism. Some people can get what we call an autoimmune disease, where your own body sort of is fighting against your thyroid. We know about autoimmune diseases from things like lupus, things like rheumatoid arthritis, but Hashimoto's thyroiditis, funny name, but it's also an autoimmune disorder of your thyroid, which can cause those symptoms as well.
So I had a question about having a higher risk of developing, like what type of conditions that will cause you to develop thyroids or
Right.
issues with your
So,
thyroid.
yeah, good question. Good question. I mean, we know that a lot of thyroid disease can be familial, sort of genetic. There's a genetic component to it. There's also, if you have diabetes, you also have a little bit of a higher developing thyroid disease. If you've ever had any type of cancer or radiation to your head or neck in the past, that can lead to it. And then you've got here listed, like we said, diabetes, some anemias, a condition of your adrenal gland, with hormones in your body. So if you have immune disease like lupus or rheumatoid, you are more likely to get another autoimmune disease like a low thyroid. So it puts you at greater risk. But a lot of times it's genetic. It's also, like we talked about, in females, older, and then these other conditions that can do it.
So, I have the daughter who's type 1 diabetes, my 16-year-old. And so her doctor, doing an examination, they found a nodule on her thyroid. And I'm just like, okay, panicking, like, what is this? Why is there a nodule on her thyroid? So, the doctor, they examined it, they looked at it, did blood tests and everything. And she said she wasn't really concerned, like overly concerned about it, that she will revisit it and look at it again in about 6 months just to see, has it grown? What is it doing? Is it causing any type of issues? But, she didn't want us to stress about it. And then as I was doing the research for this, and I saw that, if you have type 1 diabetes, that more than likely you could have thyroid issues. And I'm like, wow. So yeah, just learned something new about it. I didn't know that. And I'm glad that I did, because I can kind of better help and assist my daughter who's dealing with it, just knowing more information about it.
Right. Yeah. Very important. Right. So type 1 diabetes for sure. And also type 2 diabetes, a little bit lower risk, but they also are at risk. And then you mentioned, nodules, and a lot of nodules of the thyroid can be what we call benign, non-cancerous. And that's why her doctor may have been not as worried about it, because a lot of them are not an issue. We look at the size, we look at we feel it, and we do other things to be able to say, does this seem like a problem or not? And then we also do the blood work, right, to make sure that thyroid levels are normal. If you have an enlarged thyroid, or your doctor's at all concerned about your thyroid, we can do tests like a thyroid ultrasound that will find nodules and concerning spots.
Or even, if it's necessary, a biopsy.
Yes.
If it came to that point.
Yeah. Sometimes if it's once they do an ultrasound and they can see the thyroid gland clearer, depending on what it looks like, they need to do what they call a fine needle biopsy, where they take a really, really tiny needle. Of course, they numb you up. They take a small needle and they put it into the thyroid and suck out some cells. And then we can look at that under the microscope to see, is it anything we should be concerned about or not?
Wow. Victoria, thank you for joining us. She says, hello, Dr. Michelle.
Hello, thank you for listening. Hopefully you're gaining some knowledge here, and take whatever you learn and share it with others. You know, if you know people, like we always talk about, right? What we learn here, we want to share with others. If you know people with diabetes, if you know someone with autoimmune diseases, and, you know, we can share what we know. I've had people who they didn't know they had a thyroid issue, but someone looking at them saw that their thyroid looked enlarged, right? Because you're looking at yourself every day. You may not see the subtle changes that someone else can see when they see you.
That is so true. Like sometimes I see people, even with diabetes, like if you see the darker neck, the neck and the back darker, and you see someone that has, you know, their neck is like really fat here, I tend to notice it. I tend to clue in on it. I don't always say anything because, you know, sometimes you don't know how people will respond to it, or they may already know and be dealing with the issue already. So,
Right.
but I do kind of take
Right.
notice since we've been doing these shows. I kind of notice little things like that.
Yeah, very true, right. And if it's someone, you know, that you're close to, you feel comfortable talking with, you can just say, hey, I was, you know, noticing whatever. I was just a little concerned because I heard that, you know, that could be a sign of something, right? And I just wanted you to know maybe you should get it checked out, right? So hopefully someone would be happy that you are enough to mention that.
Doc, some people are afraid that, you know, if they have been diagnosed with thyroid disease or issues, that they are afraid that they're going to lose their hair.
Yeah, so in patients who have low thyroid, you can notice thinning hair. That is a sign of a low thyroid. However, the great thing about thyroid disease is we have great options for treatment, right? So yes, if you're starting to notice hair loss, for sure it could be many things, including thyroid disease or a hair condition itself, right? Or another autoimmune disease that can do that. But it certainly is a sign of a low thyroid. And again, we have medications that can bring your thyroid numbers back into balance and help those symptoms significantly.
All right. I wanted to read a comment that Victoria left. And she said that this is valuable information and it is worth sharing. So it really is. I think that like some people, if it doesn't apply to you, then you may know someone else that it may apply to. You know, take the information and, you know, send a video to someone else that may need it, that may be afraid to go and get help or seek out any issues that they're having. And that's really what
Yeah.
this show is about. It's about support for those who may be, you know, struggling in their health and they want to bring some type of balance to it. This information is free, so Doc Michelle is not charging you for the information.
Right.
This is free information that she gives out every single month that helps you along your health journey. We always say we don't believe in diets, but we believe in lifestyle. So it's all
Right.
about your
Yes.
lifestyle.
Yes. And we always talk about, especially for hypothyroid, it's important to have a good diet, continue exercising, you know, diet and exercise for sure is always the base of what we talk about in medicine. We do have medications. And when you do have hypo or hyperthyroid, it cannot just be treated by diet, but your diet can certainly help your symptoms. But you usually need medication and treatment for that.
Do you or have you heard that certain foods actually aggravate your thyroids more?
I think foods that are high in iodine, well, too much iodine is bad for us, and too little iodine is bad for us, right? We know that we don't really have iodine deficiency in the US. In some underdeveloped countries, they do, and they do have more issues with hypothyroidism there. But in general, there are certain foods and medications that can cause hypothyroidism. There's some heart medications that can lead to hypothyroidism as well. So another reason I always talk about take all your meds, tell your doctor what medications you're on, because they may be causing some symptoms. And also, when you're on a thyroid medication, it's important to know that they can interact with your other medications. And we often will recommend that patients take their thyroid medications separate from all their other medications. So usually like first thing in the morning, we'll tell patients, just put your thyroid medication bottle by your bedside with a glass of water. So before you even get out of bed, you just take it, because it has a lot of interactions with some other medications that they may be on. And we want to make sure that they get that medicine in and that it's absorbed in their system.
Awesome. Victoria says she knows, she says, of course, she knows 2 people who had an autoimmune disease, and she will pass the information on to them. And we appreciate it. Thank you so much.
Yeah, that's great. And they'll appreciate it too, right? Because again, once you're at risk for one autoimmune, you can be at risk for others. And hypothyroidism is one of those that if you're not having symptoms, which many people may not, because it can just be lying a little bit low and you may not have symptoms that you recognize, but it should still be managed.
So, Doc, when we are getting our annual exam, is a thyroid something that's checked annually, or just if the doctor suspects some type of issue?
Yeah, so for the most part, it is checked annually, because sometimes most patients may have a risk factor of it, right? So we talk about females, we talk about your age, we talk about if you have diabetes, we definitely check it. If you have autoimmune disease, if you're obese, right, or overweight, which 2/3 of the population is, we might check it for that even. So in general, you're probably getting a thyroid test at least once a year. And then again, if you haven't seen your doctor, and monitor those symptoms, go in and they can check those.
So the way that they would check for thyroids, what are some of the ways or some of the tests?
Yeah, so it's really a blood test initially, right? We check the thyroid hormone levels called T4 and T3. We'll also check what we call a TSH, which is that thyroid stimulating hormone that is released from your brain that tells your thyroid how much thyroid hormone to make. So we've got a couple of tests that we can check related to that. And it's really it's that screening. It's that if you have symptoms, or even if you have those risk factors, we can do that. And many times we will find disease in patients who don't really report significant symptoms.
Wow. Victoria says you're welcome. She said she did not know that you could have both at the same time.
2 autoimmune diseases? Oh, yes. Many people do, unfortunately.
Mm-hmm. That's a lot to deal with.
It is.
Yeah, it is. What role does the liver play when it comes to your thyroid?
Yeah, so the liver plays a part as well in like metabolism of your thyroid. And so we talk about when you have other diseases like liver disease, it may cause your thyroid hormones to not even get metabolized and broken down effectively in your body, which can lead to more thyroid in your system. Now, we haven't really talked about the hyperthyroid, right? Hyperthyroid is even more aggravating and can be more dangerous for patients, because when you have an overactive thyroid, that can cause you to have your heart can race a lot. And so that puts stress on your heart when your pulse is racing. You can have, these other symptoms like, just feeling anxious and irritable and insomnia and not being able to sleep, which can affect your whole lifestyle and being able to function and work effectively and all of those things. And so if you're having those symptoms, we definitely want to treat hyperthyroidism as well. because of that, the risk of, it causing issues with your heart. And to treat hyperthyroidism, we can sometimes use medications. Sometimes we use a treatment called radioactive iodine to kill the overactive thyroid gland, or we might use surgery.
So is that
as well?
I'm sorry, is that a one-time thing with the radioactive iodine? Is that like a one-time?
Yeah, it's
wow.
usually one time. It should be a one-time thing. Sometimes depending on, because once you receive that treatment, your provider will recheck your blood work, right? And so if your blood work is still not, if your blood work shows that you're still have an overactive thyroid, you may need to be treated again. But most of the time, it should be a one-time treatment. And sometimes when we do use radioactive iodine to treat an overactive thyroid, we actually can make a person hypothyroid, in which case then they need medications to treat that, to bring things in balance. Many times when we treat an overactive thyroid, we end up with an underactive thyroid, especially if you actually remove the entire thyroid gland, and then we have to use medications for that.
Wow.
But the goal is really making sure that the thyroid numbers are stable so that you don't have those symptoms that can cause problems.
If you are just tuning into Warriors Talk with Lady ReShell and my special guest, who's really no stranger to Warriors Talk, Doc Michelle, she's talking about understanding thyroid function. We are going to take a quick break. When we come back, we're going to talk about some of the myths that are associated with thyroids. I just want to recognize one of my sponsors, who is Paula Kelly with Allstate, and she's located at 327 East Glenwood Lansing Road in Glenwood, Illinois. She could be reached at 708-758-3300. Make sure that you tell her that Warriors Talk sent you, and keep in mind that I talk about all the time that she is a breast cancer survivor, and she has been a sponsor since the show has started. So we are back on Intellectual Radio. This is Warriors Talk with Doc Michelle, and we're talking about understanding thyroid function. We just finished talking about hyperthyroidism, which is the overacting thyroid, and hypo, which is the underacting. So you have hyper and then you have hypo. So with hyper, you have some of the symptoms that you will experience. With hyper, which is overacting, she mentioned anxiety. You may be nervous, have trouble sleeping, you may lose weight, you may have weaknesses, tremors. And then with the I get it mixed up, hypo, which is underacting. You are going to be fatigued. You may gain weight. You may experience forgetfulness, frequent and heavy menstrual periods. She did mention there. Having dry or coarse hair, even a hoarse voice. Now, so Doc, when we hear, I always wonder why people sound like that. When you hear people with these hoarse voice, can we associate it to they have a thyroid issue?
Well, I mean, there's a lot of causes for hoarse voices. Like right now, I'm hoarse because I've been yelling at the basketball game I was at. But when your thyroid, because it sits right around your trachea and your larynx, your voice box, if it is swollen, it can sort of press on that area and you can have some hoarseness. So again, if someone comes to the doctor and they tell me that their voice has changed and they're feeling like they're speaking more hoarse, I would check a thyroid. There's a lot of other things that we check too, right? We want to make sure there's no other growths on the thyroid, on the voice box, no cancer, no infections. There's lots of other things, but one of the things we think about when someone comes in with a new hoarseness is checking their thyroid gland.
Wow. All right. Yeah. Well, let's talk about some of these facts and myths as it relates to thyroid. So it's the lowdown on the 10 common thyroid myths. I like that, the lowdown. So Doc, I'll give you either a fact or a myth. You let me know what's what. So the first one is a lump or nodule in the thyroid means that you have thyroid cancer.
Well, not so, right? Because we already said that some nodules can be benign and non-cancerous. So if you feel a nodule or a bump there, get it checked out, because thyroid cancer, most thyroid cancer, probably 80% of thyroid cancer is slow growing and curative with, taking out that area of the thyroid. And so if you feel a nodule or a bump, if it was cancer, we want to catch that early too, right? Sometimes we can really just watch it, because for the most part, it doesn't cause a lot, but there are some types of thyroid cancers that can grow quickly and be more aggressive and need other, treatments for it, chemo and radiation. But not the fact that you have a nodule does not mean you have cancer, but it does not mean you ignore it either. So.
All right. So if you have a thyroid problem, will it develop into a goiter?
Not necessarily. No. A goiter is different, right? So a goiter is this overactive part of your thyroid gland that gets swollen, and it's releasing a lot of thyroid hormone. And that thyroid hormone causes those symptoms we talked about. Sometimes it can cause the bulging eyes. Luckily, we have treatments for that as well now. But your question was, thyroid disease does not equal necessarily goiter.
I think you just answered one of the other ones, which was all people with thyroid problems have the bulging eyes.
Not all. Some do not, right? But if we and there's other things that cause bulging eyes, but that overactive, a lot of that T4 and that stimulation always can lead to the eye disease, and those bulging eyes give you the staring effect. But luckily, there's medications for that as well now.
No, Victoria question was centered around the age. She asked, if the medical check is done regularly, does it start at a particular age? So this next one may help you answer that one. It says only middle-aged or older women have thyroid problems.
That's not true. So the risk does increase with age, but thyroid disease can occur in anyone, right? We even talked about postpartum. Sometimes people will get inflammation of their thyroid and it can become underactive. So depending on your risk factors, your symptoms, the other things going on, like I said, for type 1 and type 2 diabetes, we're going to check a thyroid at least annually, once a year. If you're obese or overweight, we're going to check a thyroid, and then depending on those other symptoms.
Awesome.
At any age, because young people, teenagers, 20-year-olds can have thyroid problems.
So a fact or a myth, Doc, thyroid problems are best diagnosed by identifying symptoms.
No, because some people have no symptoms, right? Some people have no symptoms that they really key in on, because as we said, a lot of those symptoms can be from a lot of different things. So we ask you those in our history. We're going to ask you those type of questions, right? About how you've been feeling. Are you having any unexplained weight loss or weight gain? Are you feeling particularly fatigued? All those questions we ask in our history. But then to really diagnose it, we've got to do the blood work. We've got to do the blood test.
Got to do the blood work. All right. A fact or myth, thyroid disease is easy to treat.
I would say yes, because we have good medications to give to put your levels back in balance to a normal level. Levothyroxine, when you have an underactive thyroid, we use that as Synthroid. When you're overactive, we use either radioactive iodine or surgery. So relatively easy to treat once we diagnose it.
So you got to make sure you get in there so that they can diagnose it. So you can't always go on symptoms because you may not have any.
Can't always.
All
Right.
right. A fact or a myth: is safer and more natural to treat thyroid disease with iodine or salt rather than prescription medicine.
No, we can't do that. We talked about that before, right? First of all, we get enough iodine in our diets with all the salt that's in the American diet anyway. And our salt has iodine in it. So you don't want to use that as your treatment for an underactive or overactive thyroid. You really need the medications. And some people if you don't understand that and you think, oh, I've been taking my meds long enough, I don't need them anymore. Because the great thing is, when we give you the medication and then we check your thyroid levels, the numbers that we check should now be in the normal range. So some people will take that as, oh, my numbers are normal now, I can stop my thyroid medicine. But here's the news, that once you're on thyroid medication, if you need thyroid medication, you have to take it for life.
Oh, wow.
That won't get better. You have to take it for life
So
if your thyroid is underactive.
So is it a way, doctor, is it a way for you to treat it naturally is it a way for you? Like sometimes I know with like diabetes, type 2 diabetes, or maybe high blood pressure, before you get on that medicine, there are some things that the doctor could say, okay,
Right.
exercise, watch what you're eating, do these things, and let's revisit it before you start the medicine, which you may be on for life.
Right. So if you think about when we started, we talked about what the risk factors are. If you're at risk for thyroid disease, basically, based on your genetics or your diabetes or, your family history, there's not a lot that you can do to prevent it. I'm always a fan of your plant-based diet. Make sure you're getting your minerals and your vitamins and all of those things that allows your body to function at its best, do what it's supposed to do naturally, right? Because, in medicine, we don't know all the answers, right? There are things that are undiscovered, right? But what we know is when you eat a plant-based diet, you in general are decreasing the inflammation in your body, right? The inflammatory factors. And so we're always going to recommend that. But when you say, is there something we can do to prevent it, right? It's hard to say yes.
Because diet alone won't do it.
Not diet alone.
Diet alone won't do it. So it's other things that are factored in with it.
Yeah.
Okay.
And you don't hear me say that a lot.
I know. Because normally we do push it. Diet, we do push the exercise, and another thing that you said about it being hereditary in your family, like with diabetes, it's hereditary. Type 2 is really hereditary in my family, but I know with exercise and eating right, if I am to be diagnosed, if I'm doing all these things right now, it can push it off.
Right.
They could push it off for a long time, probably until you get to that age to where, it's normal for you to get it, maybe around 60 or whatever. But I know that, if you're doing those things, it can help, it can help decrease your risk, but it won't take it away altogether, should I say.
Right.
If that makes sense.
Right. Yep, exactly. Okay. Exactly. And like we said, there's some medications that can cause thyroid disease, some heart medications that can cause your thyroid to be underactive, those autoimmune diseases, so there's certain things that you can't do a lot to now prevent you from becoming hypothyroid, but you would want to catch those symptoms early because we do have simple medications to treat it. And if your thyroid is underactive and we check the level and it's underactive, there's no treatment for that that's just diet based. It has to be medication. And once you're on the medication, because that's what's going to bring your thyroid levels into normal, you've got to stay on the medication.
So don't you're at home and you thinking like, well, the last time I was at the doctor, they said that my numbers were normal and I'm feeling better. So guess what? I'm about to wean myself off this medicine.
And I've had patients do that, and they will come in and I'll check the levels and they'll be off the charts. And we're like, nope, you got to get back on it.
Dr. Michelle, thank you so much. As always, you never disappoint when it comes to just educating us on how to choose healthier lifestyle choices that will last us throughout our lifetime so that we can have a productive life and a nice quality of life as we grow older. What are some words of wisdom that you will give to someone about just understanding thyroid function or just having a healthy thyroid?
Right. Yes. So the first part with thyroid disease is just be aware of your body and your symptoms. And if anything is new to you, as we talked about, the symptoms can be quite vast from just feeling tired to feeling hot all the time. But just know that if something is different, don't just sit on that. Get it checked out. And if you have been diagnosed with thyroid disease, follow your doctor's recommendations for medications, because it's really about the quality of life and what having those irregularities can do to your body over time. We always talk about a plant-based diet, which is more of, I call it my anti-inflammatory diet, because you're giving your body all those nutrients, minerals, vitamins, and all the things it needs to function at its best. And as you say, delay the onset of anything that you may be at risk for.
Yes. Victoria said, great information, ladies. Thank you for sharing. I will rewatch to catch the past 10 minutes. So awesome. Thank you, Victoria. I appreciate that so much. Doc Michelle, please tell everybody how they can stay connected with you.
Yes, so I am on Facebook at Doc Michelle, and I'm also there on Facebook. My page is Dr. Michelle's Healthy Life Solutions. You can find me there. You can always reach out to me and ask any questions that you may have. I'm always open to that.
And if you need Dr. Michelle to be a guest on your show, be more than happy to ask her, but just not on Monday nights at 6 p.m. because this is where she would be. Dr. Michelle, go ahead.
I have a standing appointment at that time.
Yes, and we over here at Warriors Talk appreciate you and your dedication. So thank you so much, Dr. Michelle. I appreciate you.
Thank you, Lady ReShell.
You're welcome. I will highlight my closing sponsor, you guys, which is Gloria Dotson with Mary Kay, and she's catering to all of your beauty needs from head to toe. You can go over to marykay.com/GDOTSON and let her know that Warriors Talk sent you. Check out some of her products. Join me next Monday at 6 p.m. right here on Intellectual Radio. And stay tuned for The People Show with Mark Wallace and Charles Thomas at 7 p.m. So don't go anywhere. I'll leave you with these words of wisdom. A healthy outside starts from the inside. As always, thank you for tuning in to Warriors Talk with author and founder Lady ReShell, where we are changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady ReShell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1 on all social media outlets, and Warriors Talk with Lady ReShell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on IntellectualRadio.com for Warriors Talk with Lady ReShell, where we encourage, educate, and empower you into action.